density, yeah, higher density of the material, because I have the more light photons after that. And effective or atomic number is important, and detailed term and anything this is, but density is very important between these properties. And this slide, this is the properties of the NI, and this is not important for the world. Received by the collimator, and after that received by the in the crystal. What is the output? Light photons. In the crystal, this output is at the light, not light. And after that, and I highlighted this another point, is that if energy of the gamma ray is increased, after that, the number of light photons increase, and between this is a direct relationship. If the energy of the photons increase, the number of the light photons again increase. Yeah. After that, the output of my crystal is that the light photon, and after that, this light photon received by the TMQ or photomultiplier tube. What is the role of the photomultiplier tube? This is my source, and after that's detector, and this is crystal, and this is my PM tube. This is photomultiplier tube.
Convert light into
The role of the photomultiplier tube is that convert light photons to the electronic pulse, and after that we have the localization electronic, and localization electronic give this electronic pulse, and after that give me image. This is all of the process in the nuclear medicine or in the experiment. Okay. How work the PM tube? This is the schematic or component of the PM tube. This is my crystal. This is NR. Yeah. Convert the gamma ray to the light photons. Yeah. After that, received by the PM tube. In the PM tube, the important component at the first is that the photocathode. This is here. Yeah. Photocathode. Photocathode converted the light photon to the electrons. Yeah? What is the role of the crystal?
change the neuron into light.
Light. Gamma ray to the light. This is the role of the crystal. What is the role of the photocathode?
Change into electrons.
Change light photons to
Electrons. Yeah. Change light photons to the electrons. Yeah. Now, after photocathode, we have a lot of electrons. Yeah. But the number of electrons is very low. And this is not enough for me. And I want to amplify or increase the electrons. Why? By the diode. This is my diode. Approximately we have 10 diodes that the high voltage is connected this diode. Yeah. After photocathode, I have the electrons, but this is one electron. This is electrons is heated by first diode, and because this diode connected the high voltage, and in this time we have the high voltage. This high voltage increase and or amplify the number of electrons. This is 1, and this time we have more electrons. This is line, this is the number of my electrons, yeah? And again, received by second diode. And again, the second diode increase again my number of electrons. This is increase, yeah? And third diode is again increase. And this increasing or amplifying is repeated in all diodes. And at the end, I have the anode. All of the amplified electrons received by the anode, and after that generate the electrical signal or pulse. Okay? Can we review the process of the PMQ?
Yeah.
Help me.
We change like photon lights from crystal to electron signal. Then we should to amplify.
Signal.
Yeah,
Photocathode.
to electron. Electron signal. Then we should to amplify it because like, we have few electrons. Then we need more.
Yeah.
After that we amplify by gate like more voltage.
By the diode. Yeah. This is
Yeah.
the name of the diode. Yeah.
Yeah, exactly. Then we should collect them by the anode.
Yeah, exactly. After the anode, you have the electrical signal. This is the process of the amplifying the signal by the PM tube. This is a photon multiplier tube. We have the different shape of the photomultiplier tube. For example, this is the cube, and this is the hexagonal, and this is the circular, and this is the depend for the company, and each of them can use this. But overall, when we use the hexagonal, this is important because we have the good matching between the PM tube when we use the hexagonal. This is important. Okay, after PM tube, we have the electrical signal. And this signal received by the localization electrons. What is the role of the localization electrons? This electron define the X, Y, and Z of these photons. Yeah? X, Y, and Z. The location of the photons. After the localization electron, I know this photon where from the body. Yeah? So I know the X, Y, and Z of these photons. And after that, I can use these photons by this information to generate the image. Yeah? I know where the X, Y, Z of the photon in the body. This is the role of this electron. This is all of the process of the body. And PET aspects is against sales. They generate the image. Again, we can review. We have, this is my patient, and for example, this is my kidney, yeah? My radioactive absorbed this kidney and emitted the photons. And collimator just allow the perpendicular photons, just these photons. And after that, we have the crystal, converted the gamma ray to the light photon. And after that, we have the PM tube. The PM tube converted the light photon to the electrical signal. And again, amplify the signal. After amplify the signal, we have the localization or positioning electronic. And after that, we have three values, X, Y, and Z of the photon. After that, we can display the image on the monitor. This is all of the process in the nuclear medicine. Again, you can see all of the process in the patient. At the first, I injected the radiopharmaceutical of the patient. For example, I label it with the needle, yeah, and this material absorbed in the heart. For the next step, just my heart emitted the gamma, and this gamma ray that received by the collimator and crystal and PM tube, and this time, this is my crystal. This is highlighted. And after that, this is PMQ, converted the
photon.
light photon to the electrical signal. And after the process, we can image of the heart and the Do you have question? All of this is clear?
Yes.
This is the example of the whole body, the imaging of the bones.
LDV.
In the why we have this here more activity.
Because there are more bone here, the concentration.
This is the place. This is my injection. Yeah. This is a place injection because I be injected, and this is the angiocat. Yeah.
Yes.
This here we have the more concentration of the radioactive material. This is not the tumor. Yeah. This is don't say about this. Sometimes we have this. This is not normal in the nuclear medicine. Yeah. If I correctly inject it and don't absorb in the muscles this here, this is don't see this times. This is more absorption on the hand. But sometimes this maybe happen. And again, you can see in the bladder, this is the more activity. Why?
Because this material is collected by the kidney veins.
Yeah. This is the bone scan. Yeah. I use the kits that absorb this radioactive in the bones. Yeah. This is not in the bladder. Why? We can see the more activity in the bladder. This is about the circulation. I injected the radioactive by the hand and the angiocat, and after that circulate is the body, and after the decay of the radioactive from my body, this is the waste as the urinary. Yeah, it's all of them is collected in the bladder, and after that is decay. And this is not tumor in the bladder, not tumor in the hand. It's typical in the, but in the this here we have the metastasis, yeah, in the hip, yeah, metastasis or the tumor and primary tumor in the hip. Not. This is here, yeah. This here is again we have the metastasis.
That pubic, yeah.
This is here, yeah. This is again metastasis. That's more absorb the radioactive material. But just bladder, and this is not.
I have a question. Like if we want to check the bladder, you see in all situations the
For
bladder.
the bladder, we don't use the nuclear medicine. In the bladder, don't. This is not common. And if I want to use, this is the material, just the absorbing the bladder, but this is not common. then I use any materials. All of them is at the final absorbed. This is a bladder, and this is not correct to use the radioactive material to the function of the bladder. It's not using the nucleus. I said we have the planar imaging and 3D imaging. Planar imaging by the gamma camera and 3D imaging by the spectroscopy. And now I want to say the difference between planar imaging and or 2D imaging by 3D imaging. I said the instrument of the 2D imaging and 3D imaging by the specs is the same. We use the gamma camera for the 2D imaging and for the spec imaging. Just the difference in the take the imaging method, and I explain. This is my gamma camera image. Yeah. This is all of the material, all of the class to explain the gamma camera. This is my gamma camera, yeah, and this is my patient. This is here. If I said we have dual head, one of them is here and another is here, and I don't have another hand to explain the another head. Yeah, yeah. Imagine. This is my patient and this is my detector head, one of the detector. Yeah. If my detector head is stable, not move, this is just here. And my patient is just here. And this view, I take the image, just this view, or just this view, not this and this. One of them, just this or just this, same. This time, the imaging is the planar imaging or 2D imaging. Yeah? Okay? And my instrument is at the gamma camera. If I take the image, my gamma camera is stable, yeah, not move, and my patient is again stable. If I take image, this position, my image is named as planar imaging or 2D imaging. If my detector head or my this gamma camera rotate around the patient, I take the 3D imaging. This time his name is that spect imaging. Yeah? My instrument is again gamma camera. But if rotate around the patient, his name is 3D imaging or spect imaging. This is sometimes, for example, this is my patient's gamma camera. This is one position of the gamma camera, and again the 2D image, and again rotate, for example, 6 degrees, and again take the another image, and again 6 degrees, again another image, until 360 rotate. Yeah? This is the manner of the spect image by the gamma camera. Okay? Now, this is my gamma camera. This is my patient and dual head. If this position I take image, this is the
2D.
2D, excuse me, planar image.
Yeah.
And if my head rotated, this is the
3D.
spect image by dual head. Similar to the seat. Okay, what is the benefit of the spect imaging? So the 2D imaging. I write.
Because I can see all the whole organs like from the sides.
Yeah, exactly. Have the better contrast, and I can see the lesions directly and not superimpose all of the tissues together. Yeah. Like the planar imaging in the radiology, we have the 2D imaging. Yeah, all of the targets superimposed. and I can see the detail of the organs, detail of the lesions. But in the SPECT imaging, in the nuclear medicine, we have the better contrast, better spatial resolution, bone superimposition of the organs and images. Yeah? This is another instrument. Yeah, this slide is explained about the kind of rotationally of the heads. Generally, for the imaging of the heart, because heart is one side of the body, yeah? This is one side, this is the left side. And I use the detector that this is the degree of the detector. This is the 9, and this is not separated of them. Yeah, in the heart imaging, because my heart is left side, it's one side of the body, and in other side we don't have and don't need to image it. Yeah, just my detector is just rotation 180, not 360. Yeah, because my heart's one side of the body. Yeah, okay, this is clear for you, all of them? This is difference between the cardiac imaging and other part of the imaging. In other part of my detectors rotated
All the body.
all of the body, yeah, for the 360 degree. But in the heart imaging,
It's just one side.
just one side. And my detector is this position. Yeah, this is the 90 degree, not separated, opposite of it. This is one. Because this time we have the more sensitivity. Yeah, more sensitivity to take the image of the heart. It's like this here. And see, this is for the just heart imaging. Yeah, but this is for the another part of the imaging, and my detector is opposite of side. One of the application of the SPECT imaging is for the brain imaging. Yeah, if in the brain we have the metastases, tumors, and dysfunction and anything, we can use the SPECT imaging. And most application of the SPECT in the cardiac imaging. How we use the cardiac imaging? See here, in the normal cardiac, I expected this here we have the high activity, but we don't have here. This here we have the more activity, but this here don't have more activity. I know from this image, this here we have the dysfunction. Guys, it's defected. And this part of my heart don't work well. Yeah? This is one of your work in the nuclear medicine. This is the transfer this cardiac image. Again, this explain the heart imaging, difference between heart imaging and other part. This other part of the dual heads is this direction, but in the heart imaging, my dual detector heads is this position. Again, if my detector head close to the patient, yeah, my spatial resolution is increased. It's better. Why? Because if detector head near the patient, I can take more gamma. And after that, my image is more, the quality after my image is better. Yeah? This is the effect of the distance, the detector head of the patient. If this distance is lower, my image quality is better. Spatial resolution is better. You can difference between 6 there. More distance is long. Low distance. Again, this is explained there. If my detector near the patient, we have the more spatials. For example, one of my question at the final exam is that what is the role of the when my detector head near the patient? Which of them is the affected? For example, the contrast, spatial resolution, and sensitivity and
Special resolution.
Your friends is at first right.
Yes. جعفر تمدح بيك.
Okay, this is last step.
تمدحك.
Typically, we use two. Now I have gamma heads, camera heads. We call it two, and rotating around the patient, and each of them rotation take one projection. This is the name of the image that in each rotation, this is the projection. Name of the image in each rotation. This is my patient and this is my position of the detector head. This position we take the image and the name of this that projection. And another position we have another projection. All of the projection together until we take the 3D image. Okay. We have another terms in the nuclear medicine, in the CT scan and SPECT PET. All of the things that we have the 3D image. This is the name of this that the sinogram. What is the sinogram? I said you, in each position, through the rotating the detector head, we take the projection. Yeah? If I together all of the projections, we can generate the sinogram. The sinogram, what is? Together all of the projections.
The total of image.
Yeah. Together all of the projection to create the sinogram. What is the importance of the sinogram? Sinogram is my raw data, not image. Raw data. I collected all of the projection and generate the sinogram. After that, I reconstruct the sinogram to generate the image. How I can generate the image from the sinogram? By reconstruction. The term of the reconstruction. This is the very spread field, and this is not here. I explained for you. Just know we have two reconstruction methods. One of them is that the filter back projection, and another thing is that the iterative reconstruction. And the detail of this is not your curriculum. Just know, after I take the projection in each direction of the body, I collect all of them to generate the sinogram. Yeah. After that, I use the reconstruction method to generate the image from the sinogram. This is all of the process to generate the image in the explain the SPECT. Yeah? How we can take the imaging in this. In the hospital, you can have the SPECT CT. Yeah? In the one instrument, I have both SPECT and CT. SPECT CT. This is the name of this. Why? We use the SPECT with the CT with the SPECT.
To see
We can
functional
get both function and structure.
Yeah, exactly. I want again one imaging. I take the information from the function and again the anatomical. And I combine the SPECT with the CT. This is SPECT. This is the image of the SPECT. This is very high resolution and high quality from the alone SPECT imaging. Because in the functional imaging, my images don't have the exactly like the spatial resolution. Just I can see the function, don't the about detail of the anatomy. If I want to know the detail of the anatomy and I know where is I have the low function, where is what is the anatomy? Yeah, the exact place of the low function, I combine SPECT with the CT. And the image of this combination, this is very high resolution. And have the more information of the function and anatomy. This is not the speaker. Yeah, I want to play the one.
Yeah, we can.
The last one.
This is explain about the space. What is the rules?
Uh,
Sound.
Yeah.
No?
برا على صوت.
Today, generally a SPECT CT scan is performed. Images from the two different types of scans are captured during one session using a hybrid scanner, and the images are combined. Each piece of information is important, but when combined, they are even more useful. A SPECT CT scan is undertaken in two parts: the administration of the tracer and then the scan that shows how the tracer behaves in your body. A nuclear medicine is generally administered through an intravenous injection, but can also be inhaled, swallowed, or injected in the skin. What study you have will decide how the tracer is administered and whether it is done lying down on the scanner or elsewhere in a chair. The injected nuclear medicine gets taken up and concentrates in the part of the body under investigation. Some diseases cause increased function, some cause decreased function, and some cause changes in function, all of which can be imaged on the scanner. Virtually all organs and tissues can be investigated using nuclear medicine. The most common procedures include the bone to detect and assess changes in bone function associated with cancer, trauma, and metabolic changes, and many other diseases. The function of the heart can be evaluated by examining blood moving through the heart or imaging the blood flow and movement of the heart muscle itself to diagnose a variety of diseases. Nuclear medicine can also be used to study lung, kidney, thyroid, brain, and many other organs and tissues in the body, and importantly, to investigate cancer. Because some body functions are fast and some are slower, the time between administration of the tracer and the scan can vary from minutes to hours. Some people may even be required to come back on multiple days. For diagnostic scans, the nuclear medicine is radioactive and emits gamma rays that can be detected by the scanner. The SPECT-CT machine has 2 gamma cameras that detect gamma rays and produces a map of how the tracer is behaving. These detectors rotate around the body, taking images every few degrees, allowing images to be reconstructed in 3 dimensions. The SPECT scan can take 10 to 20 minutes, and then the CT scan takes less than a minute. The scan collects important information that is processed by a computer. This information is then carefully reviewed by a specialist nuclear medicine physician to produce a report for your doctor. Your doctor will use the information to help determine how to manage your specific health condition or assess the response to current management.
You see the detectors is near the patient. Give them more spatial resolution and rotate them around the patient. Take this state. Another subject is that about the PET. Moving for the rest before the starting.
10 minutes.
Yeah. This is the new